everyone, and welcome to Wisdom Teeth Wisdom. And I'm excited to welcome the host, Dr. Ted. Dr. Ted, how are you?
Great to be here. Hi, Neil.
We're going to talk about wisdom teeth removal regarding marijuana. And you have a scary story to tell, don't you?
I've run into this several times, but probably the worst case that I've run into is actually very recently doing anesthesia for wisdom teeth removal on a teen, early 20 something that wasn't aware that marijuana is a problem when it comes to going to sleep. And in fact, there are many parents that aren't aware of it. And it's a problem because recreational marijuana has a lot of THC in it, and that's what affects the ability of our sleep drug that we use, that most oral surgeons use to be able to put a patient to sleep. It's almost like putting a canceling agent in there, to just cancel it out. So what I found 20 years ago, and it still holds true, is if somebody uses or smokes marijuana up to almost 10 days, maybe even 2 weeks, within that period of coming in for me to put them to sleep, I may need to use double the amount of sleep drug in order to be able to get that person to sleep. And that takes away a lot of my control of that anesthetic. And control is number one concern for anybody who's doing anesthesia. So it's, even though this may seem like to others that it's just like having a drink, and you wouldn't drink before going in to have an anesthetic, and for different reasons, marijuana just is an issue because it'll just cancel out the effect of the drug. And it got to the point where I almost canceled this kid's anesthesia because I was having a very difficult time getting him to sleep and getting them under control. If you want to have surgery, you want to be unaware of what's going on. You want to help your surgeon in every way possible to make this a simple process, because he can make it simple for you and make the recovery extremely rapid and comfortable. But don't throw a monkey wrench in there. And it's information, if you would, pass it along to your friends, pass it along to other parents, because anesthesiologists started realizing this a few years ago, but it's not common knowledge. You might read about it in rare articles, but when people go to oral surgeons to have surgery done, we commonly do general anesthesia in the office. We need to know that you're using marijuana, and you need to know you need to be off of it, even secondhand smoke, for at least 10 days. It hangs on for a long time, and my preference is even 2 weeks. So I wanted to get that reminder out there, and just keep in mind it's a drug, and it's one that's very potent when it comes to anesthesia.
And the best place to find information on you, Dr. Ted, is where to go.
The website for wisdom teeth that we use is tampawisdomteeth.com, and you can call our office at 813-972-3478.
All right. Well, that was another great Wisdom Teeth Wisdom, guys. Take care.